Meg, what did we learn about where this is now and the further steps that are being taken here in the U.S.?
A few important things popped out from that call just now, John. One, we don't have any new cases yet confirmed here in the United States. The count still remains at 5. They do have a few additional samples they are now testing. It's now up to 110, but they've also confirmed more negatives. Now 32 negatives out of those 110 samples, up from just 25 yesterday. Now they also started the call out by talking about diagnostic tests, and that's really important. Dr. Scott Gottlieb, the former FDA commissioner and a CNBC contributor, wrote an op-ed that's on CNBC.com now talking about the importance of getting rapid testing at the point of care. So right now, samples have to be sent to the CDC to be confirmed. They are trying to get their tests out to states and then hopefully even more broadly, once they've really confirmed that these tests work well, in order for people to be able to test and get those results back quickly. Gottlieb in that op-ed saying that that is going to be key to identifying and isolating cases, because he is concerned that the spread is not going to be able to be contained through screening measures and things like that. Also, the CDC suggesting that travel recommendations may soon change. So people should keep checking in on that if they are planning to travel to the China region. They said those might change soon. So those, to me, were the main takeaways from the CDC just now.
A conversation or a statement about avoiding travel to Hubei province, but also to take precautions in traveling to other areas in China, correct? And check with your health provider, particularly if you're an older person?
Right. We haven't seen the official update on any travel advisory changes, but they do imply we might start to see that soon. And in terms of the older folks' comment, it does seem that older people are more at risk from the severe form of this virus.
Messonnier did say the virus hasn't mutated. How important is that, Meg, in trying to isolate everything?
It's really important, Carl, because we know that work is going on right now to develop potential vaccines and drugs. And, we talked with J&J's Dr. Paul Stoffels this morning. They were talking about isolating the correct part of the virus to target with their vaccine. And they're actually going after 5 different constructs of that target at the same time in case it mutates. They need to make sure that the thing that they target remains the same for the vaccine. We also spoke with Moderna Therapeutics this morning. They, together with the NIH, have identified a target protein on the virus that they're going after. But again, if it's not the right one, the vaccine won't be effective. So being able to track how it is mutating, if it's mutating, is incredibly important.
Meg, thank you. So important to have your deep knowledge on these issues as we continue to cover this.